HealthInfoNet's notification service brings information together to inform care teams about high-risk events like emergency room visits, critical lab results, or hospital discharges that you may not know have occurred. To start the process, go to the Notification tab in the menu section of the clinical portal and click on My Subscription. Many organizations ask who should receive the email notifications. This varies in each organization, but it's generally a role or a team that needs to know when high-risk events occur. Notification subscriptions are tied to the HIN user account and email address on file. Your email address will be auto-populated in the screen. Verify this is the correct email for the subscription. Also make sure the bottom two boxes are checked under default. You can now choose what events you want to be notified about. Please note that this is a global process and you cannot customize events for different patients per user, but we can set up multiple subscriptions across a team of users. You can also create a group notification email that receives the alerts and then triages it to the appropriate people. Please contact HealthInfoNet Customer Care at 207-541-9250 for assistance with these services. The notification options are listed below. For example, let's click on Inpatient Admission. Once this is selected, you can choose how you want to receive your notification. Click Change to select your delivery options. One option is to receive notifications by email. This means that you will be alerted in real time via email when the event occurs or when new information is available, like a lab result. The email will include the patient's medical record number and associated place of service. The other option is a daily summary email. With this option, you will receive a daily email with a list of all the patient's subscription events that occurred the day prior. This is a good choice for those who do not need to intervene in real time, but on a daily basis. Once you have made your customized selections, click OK to save your changes. Once you've made all your notification selections, make sure to click Save. Here is a sample email. You will look up the patient by medical record number and place of service in the clinical portal to access the patient's name, as we do not send patient names over email. Let's review how to look up a patient after you receive the notification. First, go to the demographic search on the menu. Use the drop-down to indicate the location and copy and paste the medical record number from the email and then search. The patient name will show up below. There are two ways to assign patients to your notification subscription. For more than 100 patients, you can do a bulk load. You can contact HealthInfoNet Customer Care at 207-541-9250 for assistance with bulk loading. If you assign less than 100 patients, you can do this manually by patient in the clinical portal. HealthInfoNet recently enhanced the My Patients tool, creating a streamlined process to add and delete patients. First, click on My Patients. The required fields for search are first and last name, but you can include date of birth and zip code as well. Click Search, determine which patients you want to add, then click the green arrow next to the patient's first name. Now that patient is added to your list. To remove a patient from your list, click the red X next to the patient you want to remove. Our new version also allows for users to easily manage the list and create and modify end dates for each notification. Users can create one end date for all patients or individually by clicking on the pencil and editing. Note that patients will remain in your patient list even when the notification ends. Users can also sort by the column header and can locate a specific patient in the list with our Smart Search function.